I'm Marcia Boyles, and I'm accompanied this morning, as I always am, by Dr. Kamaljit, who is one of the stellar physicians over at the medical center. Dr. Sethi, welcome this morning, and you're going to introduce our guest.
Yes, I am. And I'm going to start off by saying that we're going to talk about preventing infections. And Dr. Sheri Nidffer has been very kind to join us today. And she's a key person, actually, at Green Spring. And I think that half the population at Green Spring knows her very well. And that is all the employees, because she is head of employee health and oversees about 2,000 folks here. And the rest of the folks interact with her because I'm sure they've seen her around, roaming the hallways and being in all the right places and being outdoors, reminding everybody about the importance of fresh air, preventing infections. And preventing infections is so important. But before we go there, let me go ahead and introduce Sheri. So Sheri has many degrees, which I will not make a bullet point list to talk about, other than to say that she's educated at 2 universities, George Mason and George Washington, and her last degree was actually a doctorate in nursing practice from George Washington. And her father also had a degree from George Washington, his PhD as well. So Sheri, welcome.
Thank you. Thank you very much.
Now, you consider yourself a nurse practitioner, is that correct?
Yes.
Thank you. And you've been here a long time.
Yeah, we just discovered yesterday, 11 years yesterday.
Yeah.
I have to double check that, but I'm pretty sure.
Yeah.
It's hard to, it just feels like I've been here forever.
Yes, 11 good years.
11 good years, that's
11
right.
good years.
I'm hoping a few more too.
Yeah. And a veteran of many serious infectious clusters that may have occurred, outbreaks, the most recent being the respiratory outbreak we had earlier this year, which I must say that I think that all of the staff and Sheri and Garden Ridge folks, physicians, providers, everybody did a fantastic job. But she'll talk more about that later. So in talking about the timeliness of preventing infections, just to put a little perspective, infections are very important at all ages, but particularly in the senior age group. And 1/3 of all deaths that occur in seniors are due to infections. So it's a good idea to take stock about how serious infections can be. They can be associated with morbidity, they may require hospitalization, and they can even be life-threatening. Now, we here at Green Spring are particularly alert to this because we have residents in independent living, but we also have continuing care. So across the United States, we have about 15,000 CC facilities per CDC. And about 1 to 3 million a year, you can see that that's quite a spread, have infections every year. And roughly 400,000 can have infections which can be fatal. So we really need to be on board and absolutely alert to what we can do to prevent infections. So as you might imagine, the common infections that occur are respiratory infections, and everybody knows about the flu and have gotten their flu shots hopefully or will shortly, pneumonia, and of course the common cold. Skin infections are very common as part of the aging of the skin. The skin becomes thin. Wounds occur often, skin tears occur often, some folks bruise easily and so on. And so you can get, soft tissue infections, skin infections. I do want to mention foot infections. We do have a podiatrist here, so if anything is happening, it's a good idea for everybody to look at their feet every day. It sounds kind of odd to even say that, but it is a good practice to look at the feet every day, because infections can occur, and we have a podiatrist who can certainly assist with that. And it's less important for independent living, but more so for CC, the development of pressure ulcers. Now, we always think of pressure ulcers as being on the back, but they can occur at any site, really. And then the commonest of all infections, which we won't dwell on today at all, of course, are urinary tract infections. We did.
Is this in both men and women?
Yes, that's correct, both men and women. They're not transmittable, and today we're talking about, ones that can be transmitted, and so we'll not talk about urinary tract infections much today. So with that, I think, Sheri, we should turn to you and ask you, when we think about transmission of infection, clearly all of the staff that work here that assist residents in so many different ways and so well, what do you do? And what kind of protocols do you have in place to deal with that?
I think that, the most important thing is that we talk about and we have annual compliance for is washing the hands. We can't say that enough. And as I was sharing earlier, when I'm preparing to do this, you just see the statistics on people that actually don't wash their hands even after they go to the bathroom. And we know the most important thing is you can't ever wash your hands too much. I mean, we don't want to abrade the skin, but very basically, I do a lot of teaching very basically as to why you would use soap and water as if you had a choice between a soap and water and a bacterial gel or foam, why that's important, and making sure you're scrubbing the nails, as we talked about.
Right.
So I think the washing of the hands is probably the most important thing to do to stop the spread of infection. Of course, somebody has to have the infectious agent, and we have to be able to pass it to our friends, and they have to be susceptible. So another piece that I do a lot of teaching on is making sure that the employees are healthy. Of course, my job here is to make sure they're healthy and happier, so then they take better care of the residents.
Right.
But in to prevent infection, you want to make sure that you're eating the right foods, exercising, a good weight, and then you can actually have your own self-defense along with your skin, which is.
Sheri, let me stop and ask you. Do you teach classes to the staff? I think most residents have no notion whatsoever about how. You talked about annual compliance. And
right.
Tell me what you mean by that.
Sure. So when an employee is first hired, they have to go through classes. New employee orientation is one where they first introduce to the idea of infection control, and then they also are, especially going into the CC, there is a separate new employee orientation for the staff that work in the continuing care, and infection control is taught there. We also have annual compliance. That is computer-based quizzes that are done for every employee on campus. And there is an infection control committee in the CC, and also now as a bigger group, including dining, administration, general service, now that has come together to kind of look at any of the outbreaks that we've had, lessons learned, and how we can better move forward.
Are there quizzes? Is that what you're suggesting?
Some of them are quizzes on the computer, for the annual compliance.
Okay.
And then there's also...
Now, does the annual compliance also include a physical?
No.
Okay.
There's no requirement for necessarily a physical. You mean for the staff to come in and have a physical? There's no requirement for that, but they can come see me for a physical if they would like to have one.
Okay, I was not sure what that included.
Oh, sure. Sure, yeah.
So, I think the thing that is so important in preventing infections and infection control, really it has two parts to it. It requires all of the providers, the caregivers, on the one hand, to do their best to prevent infection, but then there's also the resident. Each one has to do their piece. So it's not one to the exclusion of the other.
Right.
Sheri may do a fabulous job. She may keep 2,000 people healthy, but we may still have infections because when residents have an infection. So let's just go back to the hand washing for a moment. So hand washing prevents infections, there's no doubt about it. I remember one of the members of the Institute of Medicine, who is a neonatologist, being challenged by the oncologists at a meeting and saying, you're talking about preventing infections, and you're saying that infections can be prevented even in those who have cancer, who are very susceptible to infections, if you wash your hands. And he said, where's the data to prove it? It's a very good question. And she said, show me the data which says that oncologists and oncology providers have 100% hand washing rate.
Oh, my.
And that's very true.
Sure.
We don't have data to demonstrate that. So what can the providers do? So, perhaps we'll talk about this in another program, but what the providers have to do is they have to ensure that they wash their hands when they go from one individual to another. If this is in CC, certainly if they're in dining, taking all the appropriate precautions. But the residents, as Sheri was just saying, have to do the same things.
Oh, yes.
You go to the bathroom, you have to wash your hands. Something may be an encumbrance for you in washing your hands. Most of the faucets, I don't know all, but most of the faucets are touchless, so you can just put your hands,
Right.
but not all of them. And sometimes people can't turn a faucet and they may not be able to wash their hands, or they may be very arthritic, or sometimes people may just be thinking of something else and forget to wash their hands. And so, we talked about skin infections, GI we didn't mention, but, gastroenteritis and so on. But you can get eye infections too. We see some individuals who get eye infections, and the
Yes.
most important thing to do is to remember to wash your hands. So, one of the things that I find very interesting about washing hands is, even when you think that you've washed your hands well, you may not have. So how do we tell that? One of my favorite things to do, I forget the name of that box. What is it called? Is it the glow box or the germ box?
It is a germ box.
It's a
and
germ
it's
box.
glow goo that we
Okay,
don't have.
all right,
Yeah.
okay. So what it is there's a little cardboard box. It can be like a big shoe box, and it has holes on top?
Holes on top.
Holes on top. And you're supposed to put your hands inside it, and the parts of your hand that are not clean will glow. Isn't that correct? Yeah, they will glow. And it's kind of shocking. You put your hands in and then you turn them over, and guess which part of your hands are never sufficiently well washed? It's usually the areas here, closer to the wrist, because you put your hands under and you go like this, but you're not going like this. So you really have to be careful when you wash to make sure that you get this area close to the wrist. Okay? And then you're supposed to wash 20 seconds. You want to say something?
Right.
You are supposed to wash for 20 seconds.
Does anybody really do that?
I don't think so, according to the data. That not that many people are doing it. And the idea is I believe it's I have that 15 seconds spent washing your hand washes off 10 times more bacteria.
Sheri, you were also mentioning that there's a gender difference, which I think our residents will find interesting. Tell us what your...
Yeah, in one of the statistics, and like I said, I can't really mention where I heard this from, but about 75% of women wash their hands after they go to the bathroom. That means 25 or more percent don't, and then only 50% of men wash their hands after the bathroom. So, I don't even think about it because I've been ingrained to do it forever. It's just part of what I do that I didn't realize when we were talking about the hand washing. You were like, yeah, a lot of people don't wash their hands after they go to the bathroom. I'm like, what? I don't even understand that.
No, I don't either.
Because we just do it so much anyway. Yeah.
All right, we'll hope to shame the 25% of women and 50% of men that don't wash.
That's right.
Okay.
So let's talk a little bit. We started off by talking about it, but didn't dwell on it significantly, and I think there's some important things to mention. So the respiratory infections are certainly the commonest ones, and as we said, the cold, flu, pneumonia are all common ones. Curiously enough, and this is not a well-known fact, that flu and pneumonia, 90% of it occurs in those above the age of 65. So,
Really?
yes, and so that's important to remember. So one might wonder, why is this the case? So there's several reasons which are common across all infections, but some that are unique to respiratory infections. So if there is any swallowing difficulty, or there's some problem with the teeth, new dental plates are being made, or you're not chewing properly for whatever reason, and you don't swallow well, you know what, when you eat or when you swallow, it may go the wrong way and you may get aspiration. I'm sure folks have heard of aspiration. And you know, if it's bad enough, it can be associated with pneumonia. Aspiration is more likely to happen if somebody has had a stroke in the past, because swallowing may be impaired as a consequence of that old stroke. So, you know, it could be someone in CC, but it could be someone who's managing an independent living but has that problem. So if there's swallowing difficulties, it is a good idea to ask your doctor for an evaluation, and they will refer you, so that we can determine what is it that is causing that difficulty in swallowing and what is the right kind of diet for you. So if you're having difficulty chewing your food and you get a 1-pound steak for dinner, that is not the best fit, obviously. So we need to be mindful of that. The other thing I want to mention is that those who've got some underlying diseases like diabetes and COPD are also more prone to get all types of infections. And certainly the respiratory infections are part of that. So we want to encourage everybody to get their flu shot. Make sure that your vaccinations are up to date. So there's a pneumococcal vaccine, and there is also Prevnar, which has an expanded spectrum, that everybody should get those to prevent the respiratory infections. Now, going on to the GI infections, the common ones we see here, intermittently we have outbreaks of the norovirus. That can occur in independent living, it can occur in CC, it can occur anywhere. It's well known to occur on cruise liners.
Yes.
Basically, whenever you put a lot of people in one place, and it takes one person to start transmitting that virus. And we'll talk more about how to...
Are there carriers of that with no symptoms?
With norovirus? No, not with norovirus, but with C. diff, which is the next one that we're going to talk about. With C. diff, there can be those who are what we call colonizers, which means one is that you have an active infection. And the second is that you don't have an active infection yourself, but you have those bacteria. And that doesn't apply just to C. diff. The two that we would be most concerned about would be C. diff, and then that nasty bug that everybody has heard about, the MRSA, the staph, which can occur with skin infections. It can occur with respiratory infections, and pneumonias less so, more commonly the skin. But the C. diff is a GI infection. So the C. diff is very interesting because most commonly this occurs in those who've had antibiotics, usually for extended periods of time. It may occur when you're taking the antibiotic, or it may occur weeks after you've had the antibiotic. So antibiotics, basically, when they get ready to kill the bacteria, do other things which are not so good for our bodies. They alter the gut microbiome. So the microbiome, which is fascinating because every system in the body has its own microbiome. We have healthy bacteria that sit in our gut. And so when you give antibiotics, the healthy bacteria are now gone and replaced by these nasty bacteria. And C. diff is one of those. So C. diff is often associated with diarrhea. So before we knew about C. diff, we used to think, oh, diarrhea is a common side effect with antibiotics.
Yes.
And it can be, but if the diarrhea is protracted, it can also be C. diff. So we have to be very mindful of that.
Now, is C. diff curable?
It can be. There are some innovative treatments around, which we won't discuss today, but they're for another time, which can actually help to eliminate C. diff, because it can be a pesky problem, it can be recurrent, and in and of itself should get better, but one may require yet another antibiotic to control the C. diff, because you can get a colitis with it, an inflammation of the colon, and that may need to be treated as well. So when giving antibiotics, we may be able to protect the body from C. diff by giving a probiotic. So probiotics are available as tablets, they're present in yogurt. There's certain parts of Russia where the lifespan is very, very long, and they maintain one of the reasons for the longevity is eating yogurt. So I recommend it to everybody because it's a natural food. A pill is a pill, and it has other value as well, in addition to being a good source of protein. Particularly if you ate Greek yogurt, you can tell that I want to promote that. I don't own any stock any of the companies. I have nothing to disclose. And then the skin, we already talked about it. Our skin normally contains all kinds of bacteria. So that's the reason to wash our hands. So it's not just germs coming from elsewhere, it's germs which are on our hands all the time. We are breathing germs, our skin is loaded with germs. So the actual hand washing and the duration, used to be 15 seconds, was moved up to 20, because it really means you have to wash your hands thoroughly. So in other words, the kid who takes some soap really doesn't want to wash their hand and take them away. It's not going to work. You really have to, work on your hands. I was going to say almost like kneading dough, but I don't know. And you have to do that really to get rid of the bacteria from the skin. So which leads us back to you, Sheri. So what should we do? So this would constitute contact isolation. Someone's got stuff on germs somewhere. What do you do? What protocols do you have so that staff who may report to you with these problems, so that we can prevent the transmission of infection?
Right. And I think, just to back up just a minute, when we're talking about the GI illness that sometimes, the neurovirus that sometimes comes on campus, and you were asking, can you still pass it if you don't have symptoms? The neurovirus actually is one that it's very hard to keep staff and residents, I would imagine, away from the general population when you've got the neurovirus, we know you have it, and then you start to feel better, but you're actually still shedding this virus.
Still contagious.
And it's very hard. We have protocols within employee health. We have clinical practice guidelines. We also work very closely with the health department. I know we do that at Green Spring anyway. And I have to say, just as a reassurance piece, the health department is always very amazed, I would have to say, pleased with the way that we handle outbreaks at Green Spring. They very rarely have anything extra to add because our protocols are tighter than what they generally do. But if you hear about an outbreak, whether it be the flu, which is coming up, we hope we don't have one, or the neuro, because they tend to happen at the same time. It's just a crazy thing. If you're asked to stay in your room because you're sick, please stay in your room, because you can it just takes a handshake with somebody sometimes. Going to the bathroom in a public space can transfer this. We do the best we can to keep the employees home. They know that they're mandated to let me know if they're sick, and we determine when then they can come back. So to your question initially, if somebody comes in and says they are noticing that there's an infection or they've been exposed, we right away make sure that we're contacting the provider. So if they let me know, I'm contacting the providers to let them know to see if there's a pattern We also have different things like isolation carts outside the room to alert the employees so they can put on their personal protective equipment. They're taught how to leave the room with the equipment or the gowns, the masks, the gloves, how to wipe down with certain types of wipes, the machinery before the machinery is used.
Now, are you talking about Garden Ridge, or are you talking about independent
Garden.
living?
Well, I kind of mixed it all up, didn't
Yeah.
I? Sorry about that.
That's all right.
So in Garden Ridge, there would be isolation carts. In independent living, of course, you would not have that.
Okay.
Absolutely not. Did I make it confusing?
Oh, no, that's okay. So just to talk about our three modes of transmission, we'll address the other two in a moment. So what we were talking about just now was the contact isolation. So that is to say, you've got a skin infection and you know that you've got MRSA. You don't want to have any open wounds. You're in your apartment, you want to go out. You cannot have any open wounds. You must cover everything up. And the shedding of bacteria and viruses, as Sheri pointed out very rightly, can continue even when you don't have symptoms. And so, you know, those who have active infection and are recovering from it are one group, and those who are colonizers are another one. The colonizers themselves don't get anything, but others may. But they need to be aware. So the hospitals deal with this very well. Once a colonizer, always noted to have infection. So every time a patient,
Really?
yes, if they've had C. diff or if they've had MRSA, they'll take precautions every single time,
Yeah.
just to be sure that this time they don't have a resurgence of the infection and it's appropriately handled. So if you're in independent living and you know, you have an infection like a MRSA or a C. diff, it does not mean you have to be hospitalized. It means you have to take antibiotics. You have to keep covered whatever wounds you have. You can get the services of home support, or depending on your situation, home health, excuse me, who can assist you with that. But what you really want to make sure is that you don't have any open wounds when you're outside. In Garden Ridge, you'll see the carts outside. All staff at Garden Ridge, no exceptions. It includes providers, it includes visitors, it includes dining services. So if you have a C. diff, for instance, then you know the staff, when they bring you your food, they're supposed to be appropriately dressed as well. And so if you know someone who's there, or if you happen to be there yourself for whatever period of time, please always know what kind of infection you have. And if you're in isolation, ask the staff if they're not appropriately dressed, why they're not appropriately dressed. And when they wear their protective equipment, they're supposed to dispose of it before they leave your room. And there is a red liner to the wastebasket where you're supposed to drop them. And that way you prevent the transmission of infection.
Okay.
And then again, to go back, the Purell or the others, you know, the alcohol sanitizers will not work for contact, and you have to do soap and water. And so again, we mentioned the soap and water because, you know, the sanitizers are everywhere.
Yes.
And they're a good thing, but they're not enough. You know, for C. diff, they will not be enough. So in addition to contact isolation, we have two other types of transmission of infection, and they are airborne and droplet. So let's just do the droplet first, because that's probably the commoner one. These are just large particles. So when you sneeze, when you cough, you know, these droplets carry about 6 feet. So if you have a bad cold and
6 feet.
yeah, so if you're going to the dining room I certainly can't be sitting next to Sheri and sneezing on her. The other day, my grandson began to cough, and his arm went up and his head went sideways, and he was doing that. I was very impressed.
Wow.
And he's all of 6 years old.
Oh my goodness.
Very
They're
impressive.
teaching them
Yeah,
early.
I thought
That's
that
great.
was very good. But that's the right thing to do, so you're not coughing at anybody.
Yes, and I think
when you have-
reminding
yes.
residents of that is a good thing.
Yes, and it's a good idea, then carry your dinner out and eat in your apartment for a few days until it's settled down. There is no magic number that I can give and say, okay, you have a cold, you stay in for 7 days. I can't tell you that because I don't know, because different viruses are different.
Now, we're getting down here to the last second, so
Yes. So we'll just sort of wrap up by saying there's a third mode of transmission which we don't need to dwell on, and these are airborne infections. So I'll just mention them in passing. You've heard about the measles outbreak. That would be an airborne. That's why if you were
Oh,
at
is
an
that
airport,
airborne?
if you were at an airport or if you were in a plane, then you're at risk for infection. So what can we do to prevent infections? I'm going to let you go first.
I think the most important thing is to wash your hands. We've talked about that almost. We can never talk about that too much. And then when you are sick, stay away from others. And it's hard when you're feeling better. You want to get out, you want to go outside, you want to go to the store, but
Sure.
you can possibly infect others. So wash your hands, keep yourself healthy as much as you can. Cover up
Yeah.
those places that are visible, and then stay home if you're sick. That's just the most important thing.
and that's what you tell the employees and the residents.
Yes, yes, and it's hard because there's a shared dining room, and it's hard to.
Yes, it is hard.
Right, it's very hard. And the employees don't want to stay home either. This is like the only place, all my other colleagues are saying, everybody wants to go home. Not here. Everybody wants to work. It's a great place. Everybody's like, no, I want to come back. I'm like, yeah, but we don't want to get a resident sick. And we do encourage the flu shot. We have an 81% acceptance rate of the staff for flu shots, which is unparalleled anywhere across Erickson Living, because the staff really believe in protecting the residents.
I do.
Sorry. Yeah.
All right.
And so
I think we better stop.
Yeah, I think there's one other thing I'd like people to remember. In addition to staying home, avoid sick contact. So if you know somebody is sick, that may not be the best time to go meet them.
All right. Self-isolate. Don't visit your friends
Yeah.
if they're sick.
Yeah. Infections are around you. Protect yourself and protect others.
Okay, that sounds like a perfect way to end this. Protect yourself and others.